It is a wonderful morning where the president of the association, Dr. Santhosh John Abraham, is in front of the students who are going hard during their career of 3 years, during their PGT period, and they are getting Dr. Santhosh John Abraham to speak that why we all over here choose the profession. That is, his talk is on did I make the right choice to be a surgeon. So for the next few minutes, we'll wait to hear from Dr. John what he says about this philosophy.
Thank you, John. Thank you very much, the chairperson. Thank you very much, all of you. I bring in fraternal greetings again from ASI. It's not at all difficult to make the right choice when you know what is the best in for you. I've been traveling around the country and I meet a lot of postgraduate students. After having gone and got into surgery, I find some of them, I would say most of them, are still confused whether they have taken the right subject to pursue. This made me think that why don't we address this issue? And if you know the best, there is no confusion at all. You would all have read in your beginning of your career as a 17-year-old boy or a 17-year-old girl that doctors do enjoy a position through the media when they have done some heroic things. You know, there is a lot of simile, lot of things which war has given to surgery, and at war times our heroes, the surgeons in the army, navy, they do a lot of work. They deliver babies in air. They do a lot of work, amputations at odd situations, laparotomy at odd situations, etc., etc., and the news gets flashed. Is this factors which have gone through your mind as a teenager that has driven you to make medical curriculum or as a surgeon? I must confess that as a 17-year-old boy, it was my parental decision that pushed me to take medical career as a profession, right? And my parents, probably like your parents, thought that this is a very stable profession, good respect from the society, good money from at the end of the day, and they lead a comfortable life. That probably is the reason why they have pushed us to take medicine as a career. I'm no exception. I don't know about you, but I confess that was probably the reason why I was pushed into. Probably I would have been influenced by my teachers fairly well. Most of us have been having good scholastic brilliance in schools and colleges, and probably that also the peers have forced us to take medicine profession. But at the end of the day, having been exposed to the various specialties of medicine equally, who had fallen into medical career, did you make the choice to take surgery as your career? I did make my choice as a career, as surgery. During my time when I got an entrance into the surgical field, we had 2 papers to write. One was a paper on common subjects, and we were allowed to choose 3 degrees and 3 diplomas only. So if I knew what I wanted to take, I had to take a paper on surgery. So in other words, there was a test on my aptitude to take on with the curriculum, right? But I fear now, today, with the kind of entrance examination you have, you are decided by your mark and the rank. You may be good at inclination to surgery, but you will end up in rigor taking dermatology. So you don't have the chance. You don't have the choice, but you have fallen into the subject by chance. Does it really matter? It does not really matter. Choose a job that you love and you will never have to work. It's just a passion. Or if you have fallen into the specialty, but by enthusiasm, you acquire, if you are good, just practice, be passionate about it, fall in love, you will reach the unmanageable strength of the specialty. What factors go into the selection of choosing a career? Your interest is of utmost importance. Are you creative? Do you have outdoor activity? Do you have a scientific basis? Your motivation and values, your skills, and your personality. You know the way the gastroenterologists walk. They have a diarrheal walk, right? They're typically tuned to that. They're groomed like that. I'm not particularly against any gastroenterologists, but they are generally sedate, Whereas if you look at a cardiologist walking or a surgeon walking, there is a way by which they walk, the attire that they wear, the way they act, the way they behave, it's entirely different, right? So this is something which you are innate in that. So you need to decide, but having fallen into surgery, it's a shame if you're leaving. So my request to all the postgraduates, by chance you have fallen, develop the enthusiasm to surgery, work hard, marry the specialty, and be good at it. You should not leave. Why surgery is to be taken? The wield of scalpel to the humanity produces the most dramatic change of all results in all medical specialties. Today, if you have a hernia, if you see a surgeon, tomorrow the hernia doesn't exist. Today you see a physician with a bronchospasm, he will continue to have bronchospasm till he ends his life. So surgeon, I'm just saying the facts, So this is the most vibrant of the specialties. You have to cure. But do remember in your heart that patient welfare is your utmost importance. Do not do any more harm to the patient. Patients do not care how much you know of them, but by the side of the patient, the thick and thin, caring them, it's an important factor. So our prayer has to be, God, deliver us from putting knowledge before wisdom, putting science before art. Let me learn how to treat a human being rather than treating his disease. There is a stage at which probably you would say, surgery being the only option, you will deny the surgery because that's going to be beneficial, not beneficial to the patient. Are surgeons born? Some of the people have got some innate talents of hand dexterity, right? So there is an element of an inborn quality of a surgeon. Are surgeons trained? Say yes, largely we are all trained. Surgeons are created? Yes. The hidden talents of the surgeon needs to be polished out to become a good surgeon. But what you need is an intelligence, which is an inborn thing. You cannot instill intelligence into anybody. It has to be an inborn thing. The doorway of opportunity was given to everyone equally, but some of us chose surgery. But what you read from textbook is only the knowledge. It has to be translated into the wisdom by the experience that you gain from your teachers, the ward, your mentors. You know who is a mentor by any chance? Everybody talks of mentor. Can anybody give me the answer of who was a mentor? No? You must read things outside the Bailey and Love or Das or anything other than that. You should read some fiction. You need to have vent out of emotions by seeing some films, In Greek mythology, it's not in part of my talk, but mentor was a person who was picked up by a Greek king who was going for a war. And he identified a knowledgeable person who would groom his son to occupy the chair of the throne. And when he came back after 14 years in exile on war, this fellow, his son, was brought up like a king. And then onwards, all the teachers who imbibe the quality as the role model are called mentors. It is not surgical teaching, it's the way that you start your day. I don't like people coming half-shaven to my ward. I'll just ask them, I'll buy a shaving, razor and center. They should come properly attired, These are some of the things which you will value in your career. A good judgment always comes from an experience, and an experience always comes from a bad judgment, And this is not something which like an IT professional can choose. They are today on one IT firm at Infosys at Chennai, and the next day they leave the job and join in some other software firm somewhere else. So before you take surgery as a career or a specialty as a career, think. When there was an exit examination which was done for the aptitude, the top 10 subjects were, out of that 7 were surgical specialties. The last 10 had only one surgical specialty, which is a colorectal surgery. I don't know what the reason is. And probably the matter that's driven most of these residents are the financial safety. But Today, we have this problem. The hospitals are attacked. The doctors are attacked. That's the junior doctor from Jabalpur who got attacked last month. And I have been given this cartoon on Doctor's Day on July 1st, where the surgeons are going armored to the wall, getting protected from both the patients. This shall not deter from becoming a surgeon. But this is a fact. The interest of the medical students in surgery was at its peak in 1981. This is an American literature with 12.1 students choosing the specialty, where it comes rock bottom to 5.3 in 2002. What is the reason? The reason probably is that if they can work in a less demanding specialty with the same economic status, probably they have time more to the family and others. A good surgeon, Halsted, again, you must know about Halsted. It's a fantastic fellow. You know about Halsted? Who was he? His passion was on what? Morphine, right? I'm telling you, believe me, he was a morphine, cocaine addict who got transformed into a morphine addict at a later time. You read about it, right? Is it just the dexterity of the hand that makes a surgeon? No. It's the academic skill, the technical skill, the communication skill, decision-making skill. Mind you, surgery is not just the act of cutting. It is also important that you need to teach surgery, and you could be a good orator in spreading the message of surgery. So this could a combination of everything. Let me share with you, as a student of surgery, I worked hard. I had many sleepless nights, worked days together without holidays, vacation, weekends. It had been a stressful life. As a junior surgeon post-MS, I had not spent enough time with my family, spent more time in the OT. What taught me, the patients taught me, that I still enjoy to be a surgeon. Spending 30 years in surgery, I can point out that surgery should be measured beyond the operating room and the skill. You need to have intelligence, you need to have courage, you need to have perseverance. What kind of a courage? The courage that makes you extraordinary among the ordinary fellows, which is a crisis management. You don't have any data in front of you while you're operating. It bleeds, you got to stop it. No data will get you there, right? What is the latest development in hemodynamics or statins? It will not help you. You got to stop it. No data will come in your experience, what your mentors have passed you. That is what makes you extraordinary among the ordinary. It is the repetitive performance of a specific task, just like what Michael Debicki done, make him an immemorable man in the scientific field. You know anything about Sir Frederick Treves? He is a Victorian surgeon who lived in the United Kingdom. He was one who developed appendicectomy. On the day prior to the coronation of King Edward, he had an appendicitis. King coronation, the entire world is looking forward to have the coronation function. He had appendicitis, and Frederick Treves was asked to see him, and he said, "King, you will have to have an appendicectomy done." Everybody is shocked, and he said, "Then sir, if you decline, then sir, you will go to the coronation as the corpse. You should have the courage to tell that you are patient, that look, this is the only way to go forwards. You should have the wisdom and the conviction for that. It may be a heroic surgery at times when things are against you, but that is what courage is. And you do, the only way to do great things would be love what you do, as said James Rose. It's different to lead a surgical team compared to a physician's team. Surgeon as a leader has to take the forefront, but a physician can sit at home and order for things. Bronchospasm will still continue, believe me. But an appendicitis gets cured by the surgeon. The professionalism, technique, timing of surgery, temperament of teaching, all these matters in making a surgeon. I don't know how many of you are members of the Association of Surgeons of India. There is a small logo there which says Vayam Seva Mahe. We are here for service. ASI is tuned to provide the platform for learning. Together we learn, together we teach. Let's learn something new today, a procedure, a technique, a concept, and let us make each other teach each other, learn a procedure. There are so many things which money can buy, from manners to morals to respect and character. There are lots of things. As surgery becomes increasingly minimally invasive, you have a problem, and the surgeon may probably move away from the confines of four walls of the operating theatre. But there is no elevator to success, let me tell you. It's the painstaking hard work that takes you to the above. Build up a team. The team trusts in you, and you have trusted the team. That's my team. And I enjoy being a surgeon. I can make someone better. I can save a family. I'm part of a miracle and a symbol of hope and despair. You have to teach the surgical nuances, learn from the nuances of surgery. I learn every day from my students. This is the impetus that is doing this normal CME in Chennai. Teaching the youngsters, being the youngsters, make you young. And I'm taking off the mask and saying that, as Oscar Wilde said, he will tell you the truth. Did I make the right choice to be a surgeon? Yes, I did. It's rewarding, offers a high level of job security, comfortable income, I must tell you, constantly be learning new skills. I dedicate this talk to all my colleagues who strive hard to perform surgery, teach the students, and to you, the people in the making of being a surgeon. Thank you very much. One question, please.
Thank you, sir. Thank you very much for your enlightening talk. I feel also the same the way you feel. We are the surgeons, we love surgery, so we are the surgeons and we are leaders. I also ask the students to follow that. So, thank you very much again, sir.